Welcome to the National Kidney Foundation's Facebook Live. I see that people are starting to tune in. Let's give everyone a chance to sign on, so we'll wait a minute or two. Welcome to the National Kidney Foundation's Facebook Live. We'll be talking about coronavirus, what people treated with dialysis and kidney transplant recipients need to know. We are just waiting a few minutes for others to join. And when we have a quorum, we'll begin. I think that people are starting to join. I'm just going to wait a minute or two more to give folks a chance to sign on. This is the National Kidney Foundation's Facebook Live on coronavirus, what people treated with dialysis and kidney transplant need to know. I think we have a good number joining, so I will begin. So I'm Dr. Joseph Vassalotti. I'm a nephrologist or kidney doctor. I'm the National Kidney Foundation's Chief Medical Officer. I'm clinical professor at Icahn School of Medicine at Mount Sinai, and I'm so pleased that we're here connecting together virtually to talk about coronavirus and the risk of coronavirus. We're really going to focus on what you can do, how you can protect yourself, how your unique situation with kidney disease may impact your risk for coronavirus, and how you can work with your healthcare team, with your dialysis care team, with your kidney transplant care team. If you have chronic kidney disease and you're not treated with dialysis or kidney transplant, with your primary care clinician or your nephrologist. The way we'll organize the time we have together is that I will talk briefly about coronavirus and the risk and what you can do to prevent it and what to do if you think you might have it in general terms. Then I'll talk a little bit about the special issue of the people treated with dialysis, some special circumstances there for you to consider. Then I will address those who have received the gift of life, kidney transplant recipients. And then we're very much looking forward to a question and answer session and engaging you with your concerns and your questions. I'm sure that we will not have enough time to answer all the questions in the next half hour or so, when we will make every effort we can to answer all your questions in the next day. For those of you who may have friends or colleagues who are not able to attend today, we will be recording this on Facebook, and this will be available by recording in the future. And like many of you who are at home, I'm at home too, working from home. I think that I want to start with just some basics. We're going to talk about the virus, which is what I'm going to call the coronavirus. It has a scientific name, SARS-CoV-2. based on some experience of previous viruses, but for our purposes, I'm going to stick with coronavirus. And then COVID-19 really is just an acronym. The COVID is for coronavirus, the D is for disease, and the 19 is for when, in 2019, when the disease first appeared worldwide. Let's talk a little bit about prevention, and prevention is so important, especially because the stakes seem to be a bit higher for those treated with dialysis and kidney transplant recipients. It seems that the severity of COVID-19 is worse or is more severe in people who are treated with dialysis and those who have received kidney transplants, and probably for people with CKD. The data is accumulating. It doesn't mean that if you get COVID-19, you have to have a bad outcome. It just means that you're at increased risk, and that's why we want to redouble our efforts to prevent COVID-19. So I will be referring to the CDC website, and I'm just going to show you the CDC website here that you may be able to see. This shows you how the virus spreads, and it spreads between people who are in close contact, so typically within 6 feet. It spreads through respiratory droplets. It enters the body through the eyes, the nose, and the mouth. So that's why our prevention efforts are focused there. So what can you do to prevent this? Of course, you've heard about the hand washing. And so you want to wash your hands with soap and water. You want to wash for 20 seconds. You want to cover your whole hand space. You want to make sure that you reach your fingernails, and with soap and water, you clean your fingernails as well. This is going to be especially important to wash your hands if you have to go outside, if you potentially come into contact with others who may be infected. The other point that I would make here is that sometimes maybe you're at home and you've already washed your hands multiple times during the day. Of course, you can use a hand sanitizer instead, and that would be with 60% alcohol. And we want to try to limit touching our eyes, our nose, and our mouth, especially when we come back from being outside, or especially when we're potentially in contact with others. And speaking of contact with others, most of us are staying home. We're going to try to avoid contact with others. We're going to try to be 6 feet away from others. And of course, we're going to ask our friends and our contacts to stay home if they're sick. And if we cough or if we sneeze, we're going to want to use a tissue, and we're going to want to throw that tissue in the garbage right away. The other point is that if we don't have a tissue handy, we can sneeze into the crook of our elbow. And of course, then you have to be careful to clean your clothing, because that can potentially have either the coronavirus, or perhaps you have another type of virus, and you don't want to expose others. And then the last thing is that some of you will be considering wearing gloves and masks. And certainly you should especially work with your dialysis care team about when that's indicated. One of the things that's helpful for is you may touch your face less when you have those protections. And again, work with your dialysis care team about how and when to do that. The other point I would make is that what do I do if I may have COVID-19, or if I'm concerned I have it? So this is, again, back to the CDC website, just showing you here the 3 different major symptoms. So we have here, this is fever here, then we have cough, and then we have shortness of breath. So fever, cough, and shortness of breath are the main symptoms. The cough tends to be dry. It can be mucus producing, or productive, as we say. The shortness of breath is important to point out because the virus infects the lungs, and that's a severe symptom potentially. So if you have those symptoms, especially the shortness of breath, you're going to want to contact your dialysis care team or your transplant care team, or your other clinicians that are caring for you if you have chronic kidney disease. I'll just mention really quickly, I have a dry cough occasionally. I have allergies. I have runny nose sometimes or stuffy nose, but I don't have fever and I don't have shortness of breath. So we don't want to confuse seasonal allergies with COVID-19. So just a cough, may not be COVID-19. You certainly watch for fever and watch for shortness of breath. One of the issues that we've been asked, and we'll start think about questions, but one of the issues we've been asked is for dialysis patients that, what can we do to maintain social distancing because we have to come to our dialysis treatments typically 3 times a week. So I think the most important thing to emphasize for the dialysis treated individual is to come to your dialysis sessions. That's so important. From other countries, we've learned that some of the patients who got sick with COVID-19, their poor outcomes were related to missing their dialysis treatment, not to the infection. So very important to maintain your dialysis treatment in this time. If you think you have COVID-19, you work with your dialysis clinics. The clinics are working very hard to address this, and they may have special accommodations for you, special steps that they'll take if you are potentially infected with COVID-19, and they may make special arrangements for you before dialysis. For the transplant treated patient, I think it's really important to say that you need to continue to take your immunosuppressive medications. The immunosuppressive medications help prevent rejection and help keep you healthy. And this is not a time to be scaling down or pacing out your immunosuppressive medications or skipping doses. Take the medications as regularly as you possibly can. If you change your medications now, we don't want to have you undergo the risk of rejection and potentially the need for a hospitalization or hospital care, which could actually paradoxically increase your risk of COVID-19 if you come to the hospital now. For both dialysis treated patients and kidney transplant recipients and people with CKD, in general right now, we're avoiding or limiting routine visits. So what can you do? If it's a routine visit that's scheduled for April 1st, maybe you can convert that into a video visit. If that visit is not, or a telehealth visit, if that visit is not urgent and you may want to delay that visit, it's really up to you and your care team, but try to avoid non-urgent visits at this time. That will help reduce your risk of COVID-19, and that also will help your healthcare communities deal with this crisis and appropriately. Dental visits are particularly concerning because they put you at risk potentially for exposure, and if you are infected, you can expose others. So it's very important to avoid non-urgent dental visits at this time as well. It's really crucial that we don't try to treat ourselves, that we don't try to adjust our medications or take medications that we think may prevent COVID-19. There are a number of medications now that are being studied to both preventative and to treat COVID-19, but we don't advise that you should self-medicate or change your medications because you're concerned of the risk of COVID-19. For both dialysis-treated patients and kidney transplant recipients, and also for others with kidney disease, I would be remiss if I didn't say that the National Kidney Foundation offers this website, which you can access here. And there are a number of questions and answers that are relevant and much more detailed than I'm able to cover here in this brief period of time we have together. And this is going to be updated. It's going to be very robust. So please engage there. Lastly, um, the days that come up um, may get worse and worse before they get better and better. We have to work together. This is a national effort. This is almost like wartime where we're fighting an invisible virus. And it's so important that we work together. And if you're feeling a little bit afraid now, that's totally understandable. This is a time where we can hopefully take our fear and think about how we can transform it into something practical, how we can prevent the disease, how we can address our circle of our contacts to help them to prevent the spread of the disease. If you're feeling lonely, maybe this is a good time to call a friend or to contact a friend with some kind of video communication. And we want you to know that the National Kidney Foundation is here to help support you through this time. And of course, what I'm saying today is only to supplement your your care clinicians and not to replace that. It's only to help inform you. I'm really pleased that we have this time together and we have quite a few minutes left, and I will start to address some of the questions. So, if a patient is on immune suppression and is infected with COVID-19, what is the treatment? So, I think that the treatment for a transplant recipient, a kidney transplant recipient, would have to go through the kidney transplant center. There are different therapies that are being considered, and there are trials now that are ongoing to help decide what drugs are best. The immunosuppression may be adjusted with monitoring, and so I think it's really up to your kidney transplant care team. So here's a question about how long is the infected person contagious? So that is an issue that's being addressed at the local level. That is an issue with testing. That is why if you have a mild illness or you have someone in the community has maybe just a mild fever that quickly went away by taking Tylenol, that typical period of quarantine is 14 days. But I think that's something, if you're treated with dialysis or kidney transplant, you certainly want to let your healthcare team know. They certainly want to be involved, and they certainly want to help advise you about what steps you can take. Should parents be off work to help protect children that are post-transplant? I think, families, and I think your individual decisions, it's difficult for me to dictate, but I think it's certainly something that you should consider. If work will put them at increased risk, that's certainly something to consider. And of course, I think it's one thing I didn't emphasize earlier is that we have to trust our health authorities and our local health authorities, and you may be getting different information depending on what state you live in. So I think that's very important. Are you an essential worker or not? And so I would defer to those kinds of considerations. My heart goes out to you. I know these are difficult times, and you're kind of weighing difficult decisions. So I hope what I just said will help you make an individualized decision that's best for you and your family. Does being on prednisone mask fevers? It's possible, that being on prednisone could mask a fever, especially if you're on high dose prednisone. Most patients, if they're distant from the initial kidney transplant, are probably on a low dose of prednisone, and some patients take no prednisone. Please continue your prednisone at the dose that it's currently prescribed. And so I think it's something to consider. And I think if you have other symptoms like the cough, something to be aware of. And certainly if you have cough and shortness of breath without the fever and you're on prednisone, that would be something that would require attention from your healthcare professionals. Do you recommend to take any kind of vitamins during this time? So I've heard, vitamin C is thought to be potentially helpful for the colds, for viruses. So I guess that's possible. It's water soluble. It's probably safe for people with kidney disease, but I don't think I would necessarily recommend it. I think that's something that you should consult with your clinicians on as needed, but not. I wouldn't rush out to ask them that question right now. I think that Some of you take vitamin D products for kidney disease, or some dialysis patients are taking those. And of course, you should work with your dialysis care team to decide whether or not those are appropriate to continue. But in general, I would continue the vitamin D and vitamin D products, active agents during this time. How should I be cautious at grocery stores? So that's a good question. So I think that we want to limit our contact. We want to try not to touch doors. We want to be aware that if we pick up a shopping cart, the person who touched it before that could expose us to the virus. So hand washing is so important. Don't touch your face, your eyes, your nose, your mouth when you shop. When you bring the shopping home, you're going to want to be careful with how you touch things. How you want to make sure you wash your hands for 20 seconds when you return. I think that as we go on, whether you use gloves or a mask, it depends on the availability. It's something that is probably going to be worth considering if you know how to use those. But in general, I think hand washing is something that I would emphasize, particularly on return from shopping. If a transplant recipient is having a rejection episode, will their treatment be considered essential? So I think that this is a question that has to be answered by your local transplant clinic. But in general, rejection is something that needs to be attended to quickly. So, ongoing monitoring with laboratory testing is something that's going to be important. And specific treatments in kidney biopsy may be considered. So all of those things should continue. The next question, we get this a lot, is: are routine blood draws considered non-urgent? The answer to that really depends on your unique circumstances. So if you are a kidney transplant recipient and you're several years out from your transplant and you see your doctor every 6 months, your transplant team every 6 months, and that 6 months so happens to be on April 1st, that might be worth asking if that can be delayed, or if you can have a video visit, and maybe the arrangements can be made for blood testing if it's necessary, or that can be delayed. If you're someone who is being monitored very closely and you're sooner after your kidney transplant, it may be something that those labs need to be done in some way, whether that's with a video visit and someone coming to your home to do the lab tests, or having a brief trip with social distancing to a nearby laboratory, is something you have to work out with your care team. Is it true that 2 symptoms of a virus are loss of sense of taste or smell? So I've read about this recently, and I think there's been some in the lay press interest in this. It seems to be, from what I've read, an early sign. It seems to be a real early sign of the infection, potentially. So I think it's something to be considered. I haven't seen anything published on this yet, so we'll have to follow that. And I should say, there's a huge effort right now to do research to understand the risk for your kidney transplant recipients and dialysis patients. Preliminary results seem to indicate that there is increased risk for the dialysis treated patient, the CKD patient, and the transplant patient for more severe infection, but we don't know the degree to that. There is evidence that acute kidney injury seems to be a complication of the infection in about 10% of cases that are hospitalized. More percent of cases that are hospitalized in an intensive care unit. So acute kidney injury may be a sign of more severe infection with COVID-19. And of course, there is research going on to develop a vaccine. Research on about 4 or 5 different therapies. There's also research on using convalescent serum, or serum from individuals that have recovered from the infection, and using that to treat others. So really a lot of exciting things going on. I think this field is changing almost minute by minute. Are kidney donors more vulnerable than the general population? That's an interesting question. Um, I think it, of course, has to be individualized. I think if you're a healthy kidney donor and you don't have comorbidities, your kidney function is probably normal or close to normal. I think that probably your risk is similar to that of the general population. That's what I think. I don't know if there's data on that. I think that, of course, if you're a kidney donor and after donation you've developed diabetes or hypertension or heart failure, then it's not the kidney donation as much as those conditions that would give you an increased risk. And if you've developed kidney disease after kidney donation, which is, of course, quite rare, most patients do very well. But if you developed kidney problems, then, of course, the kidney disease could, or impaired kidney function, let's say, would put you at increased risk. As the virus spreads, will dialysis centers shut down? I think we have to do everything we can to prevent that from happening. And, the National Kidney Foundation is doing a lot to work on that. And I think that there will probably be cohorting of patients, so shifts that may be devoted to patients who have the infection or potentially infected. There may be whole dialysis centers. In other countries, dialysis centers have been devoted to this infection exclusively, or patients at risk for the infection. So there may be some things, and there will be a lot of adjustment and a lot of changes to help maintain outpatient hemodialysis during this time. I should say that what is NKF doing to protect patients during this time is another question. So in addition to this Facebook Live, we may have other Facebook Lives in the future with other speakers, local speakers. We may have speakers on different topics. We have the National Kidney Foundation website, www.kidney.org, kidney.org, that of course I just showed you before. And then in terms of advocacy, NKF is a patient advocacy organization. We've redoubled our efforts to ensure that the Advancing American Kidney Health Initiative elements are realized. So we understand there may be a pause now during the COVID-19 pandemic, but we want to ensure that we do better for our patients with kidney disease, that we treat patients with CKD so there's less kidney failure. We increase access to home dialysis. We increase access to living kidney donation and to deceased kidney donation, and to preemptive kidney transplant and kidney transplant in general. Specific advocacy efforts are to increase home dialysis for patients at this time because that is something that we think will help the country as a whole overall. We're working to ensure that patients are safe during the dialysis treatments, that hospitals continue to offer transplantation where it's possible, and we understand now that's going to depend on the COVID-19 outbreak status. It's going to depend on operating room and ventilator capacity. So we understand that. And also we have to understand that the transplant centers have to consider the risk for the patient to come to the hospital now and potentially be exposed to COVID-19. So all those things have to be addressed for the transplant team to adjust and or consider in these challenging times. There's a lot to unpack there. And so that's really being done locally on the basis of how the infection is rolling out in the local community or is impacting the local community. And then, of course, we want to make sure that all patients with kidney disease have access to their medications. Transplant patients have access to their immunosuppressive medications. That we're concerned about food safety for our patients in this time. We want to make sure that patients have access to healthy foods and nutrition. And we want to make sure that patients have access to transportation. So especially important for in-center hemodialysis patients who need to go to their appointments 3 times a week, typically. So what about ACE inhibitors and angiotensin receptor blockers? I have hypertension. I take an ACE inhibitor. I'm going to keep taking it. I think you should too. I think this is a terrible time to be adjusting your medications if you're doing well and your blood pressure is well controlled. These medications prevent kidney disease progression. They reduce your risk of heart disease. So very important to continue taking those. If you do, God forbid, become infected, and I don't wish that on you, but if that happens, That's something that the care team may decide to address. That's something, a decision to stop a drug now is really up to your clinician and no one else. And certainly you as a patient should not stop your medicine because of some fear that probably we don't understand yet and needs to be studied more. Non-steroidal anti-inflammatory drugs, we generally tell patients with chronic kidney disease to try to limit their use anyway. So, we want to tell people, continue to tell people to avoid them. In general, Tylenol is being recommended, or acetaminophen at regular doses for fever. And of course, if you have a fever, that's going to make you want to consult with your clinicians. For use for aches and pains, I think it's probably better during this time in general to use acetaminophen for people with kidney diseases. So I don't think we got to everyone's questions, but we'll try to answer them in the comment section. I think that our time is running out, and I just want to thank you for your attention. It's been very engaging. I've tried to field as many questions as we can, and we've gotten a tremendous response. And we're excited to be able to interact with you during this time. This is a time, even though we're physically distant, to work together. This is a time that we need to come together and to understand that we're all in this together. This is a time that's going to bring challenges, and we'll probably have to face loss. I think we have to do our best as a nation, as a people, to move on. And I want you to know that we're here with you. The National Kidney Foundation is here to support you, and that we will prevail. And I just want to close by thanking your healthcare workers. I think that I'm going to invoke Winston Churchill, never have so many owed so much to so few. I think that we have to honor them and to thank them for what they're doing under these very difficult times. I'm trying to do my best, but I think there are people out there that are doing incredible things now, and I'm so proud. And I look forward to our future engagement and interaction. And I thank you for your attention. And this is just the beginning. The National Kidney Foundation is here to support you, and we look forward to our future interactions. And this will be recorded, and you will have your questions that weren't addressed later. Thank you very much. Be safe and be well.